Welcome, welcome. We are going to let folks make their way in from the waiting room, and we will get started in just a moment. All right. Well, welcome to our first Lunch and Learn of 2023. Thank you to everyone who is joining us live today. And thanks to everyone who is viewing this video on YouTube. We are delighted to have you with us in any time frame for the case for ending the sale of flavored tobacco products. The tobacco industry wrote the playbook for all other industries that rely on predatory practices that harm human, environmental, and ecological health, and that have caused premature death and reduced quality of life to communities, particularly for communities already experiencing health and economic disparities. I heard from lots of you in response to this invitation that this is outrageous, and all I can say is just wait till you hear what Dr. Rebecca Boulos, who is Executive Director of the Maine Public Health Association, has to share with us today. Dr. Boulos is here to talk about the environmental and human health harms of tobacco use that have been worsened by the addition of e-cigarettes, and about the campaign currently underway here in Maine to end the sale of all flavored tobacco products. Welcome, Becca. We are delighted to have you with us today. My name is Kathleen Neal. I am the Senior Director of Policy and Partnerships here at Maine Conservation Voters and Maine Conservation Alliance. Our organizations represent more than 13,000 members and supporters dedicated to protecting Maine's environment and our democracy. MCA does that through education, collaboration, and advocacy, and MCV by influencing public policy, holding politicians accountable, and winning elections. A few technical notes for today. You'll hear from our speaker first, and then we'll tackle all of your questions in the Q&A session at the end. You don't have to wait, though. You can send those questions to me through the chat whenever they occur to you. I'll keep track of them and ask them of Becca following her presentation. We ask that you not message our speakers directly, as we want focus on the presentation, not the chat box. If you have any technical challenges today, you can message Will Sedlak and he will help you out. This event is being recorded and the video will be posted on our website later this afternoon, where you can also find recordings of all of our previous Lunch and Learns. Thank you again for joining us. And Becca, I will turn it over to you.
Sorry, it took me a minute to find the unmute button. Good afternoon, everybody. And thank you to everyone who's here and everyone who's watching the recording. I feel very honored to be here with you today to talk about an issue that is of significant public health importance, and that is the case for ending the sale of flavored tobacco products. As Kathleen said, my name is Becca Boulos, and I'm Executive Director at Maine Public Health Association. We are a statewide nonprofit organization focused on preventing chronic disease and poor health outcomes and promoting health across the state of Maine. So just an outline for my talk today. First, I'm going to share with you information about the cost of tobacco use in Maine, talk with you a little bit about what are flavored tobacco products, talk about tobacco industry practices, including their marketing tactics, talk about the prevalence of tobacco use in Maine, and then I will end with the health and environmental impacts of tobacco use. So every year in Maine, smoking results in $811 million in direct healthcare costs. 2,400 people die each year from smoking-related illness, and the tobacco industry spends $45 million on product marketing just in Maine. So while we and others in our advocacy space in the tobacco prevention field have been successful at getting funding for the state's tobacco prevention and control program in the state budget at around $15 million, you can see that that is about 1/3 of what the tobacco industry spends marketing its products and well below what the state spends in the healthcare costs of tobacco use. Through the advent of electronic devices, the tobacco industry has developed and markets more than 15,000 flavored products. These flavors include options such as winter menthol, peppermint mocha, cherry crush, banana blast, Pop-Tart, and cotton candy, and even Rocky Road flavored cigars. And if you were to see this on a counter, it would be hard to tell that these are indeed cigars and not an edible food item. Even those boxes on the bottom look like a nutrition facts information. It also includes, when we're talking about flavored products, mint and menthol combustible cigarettes. And menthol indeed is considered the most dangerous flavor of all because as an anesthetic, it numbs the throat and it masks the harsh taste of tobacco, which means that people can inhale even more deeply, causing even more damage to their lungs. And because of these properties, menthol cigarettes make it easier to start smoking and harder to quit using tobacco. The other thing that I want to just share with you is that flavored e-cigarettes come in packaging that looks like regular school supplies, like USB drives. And indeed, in this picture I'm showing you now, there are 18 different tobacco products. This intentional design makes it easier for kids to hide their e-cigarette use from their parents, from their teachers, and from other adults. And you can imagine, as a parent, looking in your kid's school drawer or in their backpack and seeing these, not immediately recognizing them to be tobacco products. In one Juul pod, Juul's a brand, there is the equivalent of an entire pack of cigarettes in terms of nicotine. So in thinking about how easy it is for kids to use these products with those USB devices throughout the day, you can imagine how high their nicotine content can be each day. And indeed, we heard from a parent in South Portland about her son's emergency hospital visit due to nicotine toxicity. We've also heard in communities around the state, in middle and high school, that kids don't use the bathroom at all during the school day. And this is not just one school, this is schools across the state because of the prevalence of tobacco use in the bathroom, in bathrooms at school. This targeted marketing by the tobacco industry is not new. Indeed, the tobacco industry has a long and lethal history of targeting kids and marginalized communities throughout the country with flavored products. These are some examples of marketing targeting the Black community, targeting women, including taking advantage of the women's liberation movement with You've Come a Long Way, Baby. The tribal community, including capitalizing on the environmental movement and focusing on clean drinking water. The LGBTQIA community, and kids, again, with flavors that look like common treats from the ice cream truck. And names like Unicorn Frap on Ice, which has raspberry, mango, cotton candy, and menthol flavoring. And they market these products intensely in these communities. Ads are more commonly found at events and in media targeting the LGBTQIA community in low income and racial and ethnic minority neighborhoods. And research shows that there are more tobacco retailers in these communities, that signs are larger, that prices are lower, and that stores are more likely to be close to schools. In South Portland, where I live, we have 40 tobacco retailers in the city, and most of them are located within walking distance and indeed right across the street from where kids spend their time, including schools, parks, playgrounds, churches, and even the mall. The tobacco industry uses these tactics because they work. And indeed, 4 out of 5 kids who have used tobacco started with a flavored product. And 85% of youth and 90% of young adults who use e-cigarettes use flavored products. And 70% of teens who use tobacco cite flavors as the reason that they use e-cigarettes. I do want to put a fine point on this. The results of the tobacco industry's targeting are devastating. 85% of African-American adults who smoke use menthol cigarettes, so the marketing works. And among LGBTQ young adults, they are nearly twice as likely to use tobacco as their non-LGBTQ peers. And 95% of adult smokers start by age 21. The tobacco industry's use of flavors, especially menthol, drives and perpetuates structural and systemic health disparities. The industry targets these populations in particular because they are already experiencing disparities and which worsens their health and economic security through these products. As an example of the industry's intentional focus on disadvantaged populations, in the 1990s, the tobacco industry ran a marketing campaign that was called Project SCUM, SCUM. That acronym stood for Subculture Urban Marketing. Project SCUM targeted LGBTQ and homeless populations in California. The targeting of these populations that experience marginalization is common for the tobacco industry. And that, like I've said before, includes racial and ethnic minorities, as well as people with mental and behavioral health disorders, women, people with low income, people in rural areas, and others that are experiencing barriers to achieving optimal health. I'm going to switch gears now and talk about what we're seeing in Maine. The most recent Maine Integrated Youth Health Survey, which is administered every 2 years, the data from that show that Maine use rates are higher than the national average. The rates from 2021 did go slightly down since 2019, which is not that surprising given that schools and businesses were closed because of the pandemic. But so rates did slightly go down in 2019, they went down in 2021 compared to 2019, but they're still high. Current use of any tobacco product, including combustibles, chewing tobacco, dissolvables, and e-cigarettes is 20% in Maine, and that's compared with 13.4% nationally. We do see disproportionately higher tobacco use rates among high school youth who identify as bisexual or transgender, as well as Native American students. Female use rates are higher than male use rates, and in general, across the country, not just in Maine, but the data show that youth who use e-cigarettes are 2 times more likely to switch to combustibles or start using combustibles within 2 years compared to their peers that don't use any tobacco product. This is why when we're talking about ending the sale of all flavored tobacco products, we're talking about all flavored tobacco products. Otherwise, if we leave anything on the market, youth will be attracted to what's left on the market. Nationally, there has been a substantial rise in flavored tobacco use among youth and young adults. Most of the popular flavors are pod-based in single-use cartridges, and I'll talk more about that in a moment. Among adults in 2020, 16.5% of adults smoked. Nationally, the rate was 15.5%. In 2019, 4% of adults in Maine used e-cigarettes, and in 2020, 2.7% of adults in Maine used smokeless tobacco. I just want to remind you with these statistics, first of all, that youth are using flavored products at a higher rate than adults, and that tobacco use is an addiction that starts in adolescence. I shared with you that most people who start using tobacco start before the age of 21. In part, the reason that fewer adults are using tobacco products is because we were really effective at preventing tobacco use. Until the widespread advent of these flavored devices through e-cigarettes that have really turned the tide and upended that trajectory in terms of youth use of tobacco products. The impact of nicotine addiction on youth in particular is life-altering. Our brains continue to develop till about age 26. So youth and young adults are particularly susceptible to nicotine addiction, and this addiction can increase the likelihood that they become addicted to other substances, including alcohol, cannabis, heroin, and cocaine. The reason is because nicotine reprograms the expression pattern of specific genes associated with addiction, and ultimately that alters our behavioral response to these types of substances. We are also seeing youth develop popcorn lung, which is characterized by a buildup of scar tissue in the lungs, which blocks airflow, making it harder for youth to play sports and to do other physical activities. Tobacco use is associated with increased risk of developing anxiety and depression. And the impacts of these aren't just felt by the kids that are using these products, but their peers are also impacted as social groups divide between users and non-users. Bathrooms at school become popular places to vape, as I mentioned before. And so kids that even aren't using these products are still impacted by them at school and in their social lives. For adults that use these products to quit combustibles, there are also health impacts. Research shows many cigarette smokers, in fact, do not quit combustibles with e-cigarettes. Instead, they engage in what's called dual use, so which means they continue using both combustibles and e-cigarettes. That's the most common form. It's a little under 60% of adult users who use e-cigarettes that continue to use combustibles. That then is associated with an increased risk, actually, of nicotine exposure and poorer health outcomes than using one or the other alone. E-cigarette use may also contribute to relapse of smoking in ex-smokers and encourage the initiation of tobacco use among youth and young adults, as I've mentioned before. Moreover, in addition to nicotine, e-cigarettes contain several other harmful chemicals and potentially harmful ingredients, including ultrafine particles that can be inhaled deeply into the lungs. There's evidence to suggest that these particles can lead to cardiovascular injury with links to negative effects on resting heart rate, blood pressure, and the cells that line the blood vessels. Bystanders also can breathe in this aerosol. You might see that white cloud either from someone on this walking on the sidewalk or from a car in front of you, and you can smell the flavoring that they're using. E-cigarette flavoring can contain diacetyl, which is a chemical linked to serious lung disease. They also contain VOCs, like I mentioned before, and heavy metals, such as nickel, tin, and lead. I do want to point out that with the proposed bill to end the sale of all flavored tobacco products, tobacco-flavored e-cigarettes would still be on the market. So for adult users that are trying to quit combustibles and have found e-cigarettes, they're in that other 40% or so that have been successful, that the tobacco-flavored e-cigarette would still be on the market. So for those adult users, that would still be available. I also wanted to share with you some of the environmental harms from e-cigarettes in particular. This type of waste is potentially a more serious environmental threat than cigarette butts because e-cigarettes introduce plastic, nicotine salts, heavy metals, lead, mercury, and flammable lithium-ion batteries into waterways, soil, and to wildlife. Unlike cigarette butts, e-cigarette waste doesn't biodegrade even under severe conditions. E-cigarettes left on the street eventually break down into microplastics and chemicals that flow into storm drains and pollute our waterways and wildlife. Many popular e-cigarettes are pod-based with single-use plastic cartridges, like I mentioned earlier. And indeed, these products have skyrocketed in popularity with a 1,000% increase in use among high school students between 2019 and 2020. They remained the most commonly used device type reported in 2021. E-cigarettes are considered hazardous waste, and e-liquids and e-juices with nicotine are also hazardous waste since nicotine is an acute hazardous waste. Unlike other electronics, e-cigarette manufacturers do not provide consumers with clear instructions on how to properly handle e-cigarette waste once the e-cigarette or its accessories reaches the end of life. They leave the onus of figuring that out on the consumer, which means it ends up in all sorts of places. On December 15th of last year, so just recently, a new article was published about the problem posed by the volume of e-cigarettes being put in the trash, all of which contain lithium-ion batteries. According to the article, 5 disposable vapes are being thrown away every second by young people in the US, despite the devices containing reusable lithium-ion batteries. Over the course of a year, this amounts to 150 million devices, which together contain enough lithium to power about 6,000 Teslas. Lithium is an in-demand metal because of its use of rechargeable batteries that powers everything from cell phones to electric cars. But producing it is a complex process that typically generates high carbon emissions. So in addition to the waste that's produced, we're also looking at carbon emissions for these products from the manufacture of lithium battery. The tobacco industry wrote the playbook for all future industries that rely on predatory and damaging practices that harm human, environmental, and ecological health, and which have devastated and caused premature death and reduced quality of life to communities and in Maine and across the country. As you've seen, these communities are intentionally targeted with attractive advertising to use the health-harming products, and they tend to live in proximity to the landfills and waterways where these harmful and accumulating devices end up. The bill that we're proposing to end the sale of all flavored tobacco products, including the marketing of those products, would include combustible and electronic cigarettes. The waste from these products, as I've just sharing with you, does harm Maine's environment, where it pollutes our water, air, and land with toxic chemicals, heavy metals, and residual nicotine, which can impact the health of humans and wildlife. These products are not recyclable. They are considered hazardous waste, and yet they are proven to appeal to children and to lead to nicotine addiction, disordered brain development, tobacco-related illness, and too often early death. This bill that we're proposing confronts the tobacco industry for putting profits before people and the environment, and calls out their widely adopted playbook, among other poisoning and polluting industries, of misinformation, denial, and regulatory delay. We would love for you to become involved with the campaign, and we have a few of these ideas right here. You can learn more about the issue at flavorsfitkidsmaine.org. If you're interested in getting involved with the campaign, you can email Madeline Defose, who's our field director. Contact your state legislators. I see some of you on here today. Thank you for being here. You can write a letter to the editor. And if you own a business, we have a partner in Tobacco Free Maine Works, which is a business coalition of business leaders and owners who are supportive of ending the sale of flavored tobacco products because of the impact on their business. And you can email Matt Wellington at mwellington@perg.org. This is my email. I can talk about this topic all day. I'm happy to take questions now or at a later time, but I do just want to thank you again for listening to this and for your interest. Thank you.
Thank you so much, Becca. It is just, this is awful. It is absolutely awful. And I really appreciate you being with us today to walk us through the many ways in which it is awful. So thank you. In case you did not have a chance to jot down those websites and email addresses, never fear. You will get a follow-up email later this afternoon with links to the Flavors Hook Kids campaign and all of those other calls to action as well. So look for that. You'll also get a link to the recording, and I encourage you to share that far and wide. This is something that even, I've got a high school aged kid who tells me a little bit about how much he sees this, but even still, looking at those pictures and seeing what these products really look like, it's shocking. And even knowing that it's out there, I'm not sure I would recognize it in a backpack if I was looking. It's just a lot. So thank you. I want to open it up to questions this afternoon, and we've got a couple of things to get us started here. And the first one is, how are people under the age of 21 getting these things? I mean, don't we already have laws on the books that say kids can't buy tobacco of any kind? What's the issue here?
Yeah, it's a really great question. It's an important question. So indeed, Maine did pass a law a few years ago that limits the sale of tobacco products to people who are 21 and older. So that is true. However, kids under 21 can get tobacco products through a variety of sources, including illegal retail sales. So where at the store their ID is not checked. They can get it through social sources like their friends, and their friends can get it from older siblings, from parents. I mean, when it's an e-cigarette device, those are, you see what they look like. Those are easy to take. They can also get them by stealing. So there are a variety of sources. I think one of the things to keep in mind is that the attractiveness of these products really starts with their presence in stores. So I showed you some of the examples of what these look like. That's marketing. The packaging, the product itself is marketing. And there's product placement in YouTube videos, on social media, and we don't see it as adults because we're not the target audience. It's kids that see it. That's who the marketing is for. So I bring that context up because what drives kids to want to get it from their peers is seeing that marketing. There are certainly influencers and other uses of social media to drive that demand. And then once kids get it through these different sources, their friends want to try it because they've seen that marketing. And when there's 15,000 flavors on the market and they're, s'mores flavors or that unicorn frap, all those different types of names, that also drives interest in wanting to try these products. So that's how they get it. But I just wanted to clarify why then they want to try it.
Yeah. And that gives us a little bit of an answer to another question that we had, which was, can't we just enforce the laws that we already have, right? That can't we just crack down on? So let's not let anybody buy tobacco if they're under 21. But you're describing something a little more insidious than just sales.
That's right. And I would say, a lot of the advocacy that we do at the state level, and I mentioned the $15 million that we've, the CDC recommended amount of funding for tobacco prevention and control is 15.9. So we're just about there. And part of that funding does go to the Attorney General's office to enforce these laws. One of the things I think that is not widely understood is that sales of these products is illegal online. And so there have been questions about that, like, can't they just order them online? They're not supposed to. And if you know of anyone who's doing that, you can be a little tattle turtle and let the office of the Attorney General know, because this is a priority for the AG's office, is enforcing these laws. And they can't, they do their best to proactively take action, but they definitely want to hear from people if there are online sales that they're missing.
Are there rules about store placement? Especially that little unicorn one, it looks like lip balm or something. I can imagine them being right front and center.
They're supposed to be behind the counter. Okay. If you're at like a convenience store or something like that. If you're in a vape shop, they're supposed to check your ID to make sure that you're not under 21. That's enforcement to make sure they actually do. There is a volunteer who's now a young adult, but when he was in high school, he grew up in Winslow, and he tells in his testimony to the legislature, he talks about how there was a vape shop close to him that would hold party nights for high school students. They didn't check IDs. That's how he got addicted to e-cigarettes, was because they held events. And that's just an example of, if someone knows about that, they need to tell the AG's office so there can be some, enforcement action. Because if you don't do that, then that's the type of stuff that can happen.
I know that periodically, they'll do sort of sting operations on, are you selling beer to underage kids? Does that happen for these products as well? And how can we make it happen more?
Yes, there are compliance inspections, and there are two in Maine. There are two retail compliance inspection programs. There's the SINAR inspections and FDA inspections. Both are carried out in a federal and state partnership, and that includes engagement with the Office of the Attorney General and Maine CDC. And there is engagement by local community coalitions in education for retailers, and other support along those lines. I will say it was harder to do those during COVID. And so we're a little bit backtracked on that. But like I said, this is a priority for the AG's office. And this is why ensuring that there's funding support and whatever else is needed by the state and by the Tobacco Prevention and Control Program to make these happen, that's part of our advocacy as well. It's not just taking these products off the market, but it's also ensuring that the state has what it needs to adequately enforce these laws.
Thank you. Thank you for doing all of this work and for knowing all of these pieces, because there are a lot of moving parts here. I'm curious about why sort of community level policymaking, like what's the role of community level policymaking here? And what role I'm a mom, what role do parents play? What role do schools play? How can we all do our part in keeping youth from getting hooked on these tobacco products?
Yeah, I think that's a really important question. So the industry spends $45 million a year in marketing. Let's just keep that. That's a lot of money. And there is decades of research to look at what works and what doesn't. And all of it looks at policy, systems, and environmental change. And by that, I mean looking at our social and physical environment, looking at media portrayals, so in advertising, sexualizing use. There was a former healthcare provider in South Portland that wrote a letter to the editor that as a healthcare provider, she, even knowing the health consequences when she was younger, she was drawn to the marketing, to the thought of the image of a man lighting her cigarette and what that looks like in movies. There's that component of it is attractive. So looking at that type of advertising and marketing, normalizing use, which is what we are seeing with e-cigarettes in particular, the marketing and the advertising, which, like I said, is certainly on social media, but it also is just the packaging that these products come in. It's looking at the density of retailers, like I mentioned before, that there tend to be more retailers in lower income and racial and ethnic minority neighborhoods, looking at the prices, looking at the signage, accessibility of these products, and the availability, like I said, and the price of them. I visited a store near me, just as an anecdote, I went into the store, you walk in, and the first thing that you see is like the beverage station. And to the left is where they have all their coolers where they have drinks and alcohol, beer, but also soda and things. And to the left is where the cash register is, and the cigarettes are behind the cash register. If you go to the right, that's where their deli station is. And the first thing that I noticed, because I'm paying attention to all this, is that in the deli section, they had printed out on copy paper a Marlboro sign. And that's what was in the sandwich station. It wasn't connected to the cigarettes. But when I see that, what I'm thinking is that that's prompting somebody to either remember to get their cigarettes, or maybe for someone who's trying to quit, it can encourage them to want to go get them again. So when we're talking about advertising, it's not just like the social media placement. It can also, it's in the store. Like it's also signage like that. It's on the packaging. So I think, as you go into stores around you, just start kind of paying attention, I guess, or noticing some of this marketing that we may not recognize. So when we're talking about community level policymaking and we're talking about ending the sale, but also the marketing of these products, that's what we're talking about. And the research does show in other, in municipalities and in states that have ended the sale of flavored tobacco products, and in particular at the municipal level, because we can compare similar municipalities, that when you reduce the marketing, you also reduce youth use. So there is an impact in terms of reducing the prevalence of youth tobacco use. That was a long answer to that. One part of that answer to your question. So the other things to consider in terms of risk for youth use are certainly biological and genetic factors, certainly mental and behavioral health. And like I said, the tobacco industry does have a history of marketing to people who are experiencing mental health and behavioral health challenges. We also look at peer and social pressure, so that the bathrooms have all essentially been taken over in schools by the use of these products. I mean, there is some social pressure there. That's why we're hearing from kids that they're not using the bathrooms. I know when I was in high school, there was one bathroom that you just didn't go into if you weren't smoking, but other ones were fine. And so to think about spending an entire day not being able to use the bathroom because you're uncomfortable with what's going on in there, I mean, that's really tough. And we hear from some elected officials about where are the teachers, but I mean, they're teaching, like that's what they're doing. They shouldn't have to hang out in the bathroom all day monitoring this. And certainly they're implementing monitors in the bathrooms to detect the vape smoke, but really we want teachers to be teaching, not having to monitor the bathrooms. And then there are other, I gave you examples too, just about some of the other demographic factors that increase the likelihood of being targeted by the tobacco industry, both in terms of marketing, but also in terms of the density of retailers. So I just think that it's not enough to just say that parents need to do better when we're looking at $45 million in marketing and the social pressures and the environmental pressures. I really think this is an example of where looking at the harm that these products are causing to the health of our future generations and our environment, that's why government action is important. And that's why it's not just enough to say parents need to be doing a better job. I think that's really unfair to place that level of burden on just parents.
Absolutely. And I think it really is. And it sounds like we need action at every level and from everyone. So are you connecting at all, or is the Flavors Hook Kids campaign connecting with like school counselors or school nurses or civil rights teams at schools? I'm just thinking about, how none of those entities are ever going to see $45 million a year, but how can we chip away at the influence while we're also doing our work of legislative advocacy, and we're going to get to that next, I promise. but I just want to finish that sort of what can we do in our schools and our communities today?
Yeah. So as part of the Flavors Hook Kids campaign, there are dozens of organizations across the state that have signed onto this. That includes at all different levels. It includes local nonprofits. It includes state agencies. And like I said, it includes businesses that are seeing the harm that this is impacting, the harm this is having on their business. So it's a range of organizations. And I think the greatest thing is just providing support and connecting with youth in your community. In South Portland, where I live, so one of the questions on the Maine Integrated Youth Health Survey that I mentioned the data earlier on youth tobacco use, one of them asks about mattering and asks kids how much they matter, if there's an adult in their life that they matter to. And I encourage you to look at the data for where you live. You can get it at the county level. In South Portland, it's like 50%, maybe 51% of kids don't feel like they matter to an adult in their life. And that's a community problem. That's not just a parent problem. We're all in communities. And from my perspective, taking action on this is a way of saying that we care. When we hear from kids they're not using the bathroom, that this is impacting their ability to participate in sports, that it increases their likelihood for developing other addictions, those are serious. And I think that by taking action on this, we're saying you do matter. We do see the harm this is causing, and we're going to take action. So to answer your question, Kathleen, I see this both in terms of supporting the effort to end the sale of flavored tobacco products, but I also see it as finding ways to engage with youth in your community. And there's a host of different ways to do that. But to know that kids don't feel like they matter to any adults in their life, I mean, that's heartbreaking. And I think that we all have a role to play to make sure that does not continue.
It really is heartbreaking. And I appreciate you reminding us, Becca, that one way we show kids that we care about them is by showing up, right? And being in the community, going to the school play, going to the soccer game, all of those things. But another way that we show kids that we care is passing legislation that protects them. And that is incredibly powerful. So tell us a little bit more about this bill, and particularly because I'm looking at the faces and you are too, and seeing the comments, and this is the choir, and we're all wondering who could possibly be singing a different song, right? What is the opposition to what feels like not only common sense legislation, but just moral imperative legislation? Why? Who's against this?
Yeah, it's a good question. There are some people that don't support this bill. Tobacco retailers are certainly one of those audiences. They have, concerns about losing profits, so that is an audience. There's an adult choice argument, a libertarian type of, leaning perspective that these are adult products. They're not intended to be sold to kids, even though they're getting them, and adults should be able to use what they want. There's mixed feelings on this bill in the harm reduction community. There are people, and I shared these data with you before, there are adults who have smoked combustibles and do use these products to quit, and some of them do so successfully. Most continue to use combustibles. I just want to reiterate that, but there are, and I want to honor that. I mean, that's important. I do want to just clarify and make sure everybody knows that e-cigarettes are not an FDA-approved cessation device. People who use them to quit combustibles are not under the guidance of a physician. And unlike other cessation devices that are approved by the FDA, which lower your nicotine exposure. E-cigarettes don't. So it's not like you get one cartridge that has a certain amount of nicotine and then the next cartridge has less nicotine. It's the same amount of nicotine. So in terms of weaning you off of a nicotine addiction, these products don't do that. And in fact, there was a study that was done looking at the use of these products as a cessation device, and it found that only about 20% of participants using e-cigarettes achieved smoking cessation. Most people, like 80%, who continued using e-cigarettes even later. So it's not that they necessarily quit their nicotine addiction, they just switched products. That's a more common thing that happens. And I also just want to share, again, I think I said this earlier. Excuse me? No,
I was just going to ask how that 2080, like, how does that compare to other, I mean, I know that nicotine addiction is one of the toughest ones to kick. Is it better? Are e-cigarettes better or worse than, say, like gum or the patch or whatever it is?
People that use the gum or the patch successfully are more likely to remain abstained, but it's harder to achieve success with those products. So does that answer your question? There are fewer people because, so if you are able to use those products to quit, you're more likely to stay without going back to combustibles. But those are harder for people to use successfully, I will say. But to that question, Kathleen, and I think I did say this earlier, tobacco flavored e-cigarettes will still be on the market. So people that are using these products to successfully not use combustibles can still use tobacco flavored nicotine e-cigarettes. It's just not the, cherry blast and all the other stuff that we were talking about. So that's a community that is not supportive. I think those are the major communities. Maybe I'm forgetting one, but I think those are the main arguments, is around harm reduction, adult choice, certainly the parent responsibility argument that I mentioned earlier. Yeah.
And I saw there was an article in the paper this week about some of the opposition from retailers. And I'm curious, what should we say if we're out in the world, or if we've got some fabulous lawmakers on this call today who are likely to hear from their constituents. And if somebody says, hey, this is a good chunk of my income at my convenience store, what do we say to that?
Yeah, that's a great question. There has been research by the convenience store industry. And what it really shows is that retailers can and will adjust. I mean, they have to. I'm not putting the vape shops in this category. They will have a hard time. But convenience stores, like I said, there is industry-sponsored research that shows that declines in cigarette sales does have little effect on employment. And part of that, and I think this is important, is because the profit margin, even if tobacco sales make up a large portion of their overall sales, the profit margin on that is lower than like food service items, packaged beverages. So I'm not a convenience store owner. I'm just telling you what the research says. But what the research shows is that because the profit margin is smaller, the other items that stores sell, they still maintain those sales.
That is really, really helpful. Thank you. And because we've gotten a couple of questions that make me think our audience may not know a ton about the procedure and policies in a vape shop. So do they check ID at the door, or is it just checked when you're making that purchase? You said it might be a little bit trickier for them. I mean, part of me wants to ask, well, then is a good chunk of your profit coming from illegal sales? Because that's not a good thing. But yeah, tell us how it works.
You should have your ID checked before the sale of these products. The ID check does not have to go through like a computer system. It can be a physical ID check. Certainly they have a guidebook that tells them what to pay attention to. But like I said, like the enforcement of that is important, because if it's not being enforced, then it's easier to get around. Yes, you are supposed to have your ID checked before you're able to purchase these products. I will say in South Portland, just as an example, there is a vape shop directly across the street from our middle school here. So kind of going back to that environmental component, marketing component, this isn't answering your question, but it made me think of it. Even if kids aren't going into that store every day throughout the course of their middle school, every day they're driving down Broadway, which is a major road here, they're seeing that store, they're seeing the signage. And so that still drives their interest in wanting to try those products. So I know that doesn't answer your question, but it did just jog my memory about that.
Yeah, no. Some of these flavors seem just so over the top, right? Like unicorn blast or whatever it is. But there is a flavor that has been around forever, as far as I know, right? The menthol flavor of cigarettes. And is it right that tobacco companies are working to create an exemption for menthol? Say a little more about that. And it makes me nervous.
Yeah, menthol has been around for a very long time. That's a common flavoring that the tobacco industry and legislators want to exempt because they hear from a lot of adult users that that's their preferred flavoring. And just to reiterate, menthol, because it numbs the throat and it masks the taste of tobacco, it makes it easier for people to inhale smoke because you don't taste that harsh taste of tobacco. And it allows you to inhale more deeply. So it does more damage to people's lungs. And it makes it harder for people to quit because they're addicted not only to the nicotine, but also they look for that taste of menthol. Which is why we do tend to say that it's the most dangerous flavor. And you saw it in that unicorn frap vape product that that's in those products as well. And so because of that, because of those properties of menthol in particular, and it's in combustibles, the industry is intent on seeking ways to create a loophole for menthol in towns and states that are taking action to end the sale of flavored tobacco products. Research shows that kids will buy whatever's left on the market. So if we create a menthol, keep in mind, kids have an addiction now to nicotine. And so just ending the sale of just e-cigarettes, but leaving menthol on the market, they're going to want to now smoke menthols because they still have an addiction. So we need to make sure that all flavored products are taken off the market. I think the other thing to keep in mind, and I mentioned this earlier, is just the higher prevalence of menthol cigarette use among the Black community compared to the white community. 85% of African-American smokers use menthol compared with 29% of white smokers. So it's a dramatic difference. And that is in large part due to the marketing. It's due to the advertising, to the retail sales, the density, the prices, all of those things that I've been talking about. And so when we're talking about eliminating health disparities, including menthol on this is an example of advancing health equity and not perpetuating health disparities. If we leave it on the market, we're basically turning a blind eye to the fact that the Black community has been targeted by the tobacco industry, will continue to be targeted by the tobacco industry. And, so not taking it off the market, I think, is just us kind of ignoring that fact, is my opinion.
That's that makes a lot of sense. Oof. I want to pivot just a little bit to the environmental impacts. I think, over the last many years, I think we have all, as a society, seen the intersection of vulnerabilities. And I don't think we're in the same place that we once were of saying like environmental issues over here and health issues over here. But nevertheless, let's talk about it from the products themselves, right? Not their use or their impacts, but these actual cartridges. What's in them? What happens to them? Do we have product rules? For example, the EPR, the extended producer responsibility. Do we have things that we can use to sort of force? I don't even know. Can they be recycled or? That was a million questions. Answer some of them.
So unfortunately, there's not guidance given to users of these products about what to do with them. They can't be easily recycled. That's a great question about the EPR. I don't believe these are covered, but that would be a question for me to ask Sarah Nichols at NRCM, because I don't know the answer to that. I think that the fact that the industry is not required to give any guidance or figure out a way to support municipalities in what is needed to take care of these products is just an example of another loophole that we need to address. And I think there's a reason to address it, given that even with the ending of the sale of the flavored products, like I mentioned before, the tobacco ones would still be available on the market. And people do use e-cigarettes to also vape cannabis. So there are other substances that people put in these devices, which means that ending the sale of the flavors will dramatically reduce the amount of e-cigarettes that are on the market, period. I was saying before that the most popular form of these are the single-use ones. So that's not something that people can use interchangeably with different types of oils. So that's important. That said, there will still be some on the market. So I think to your point, Kathleen, there is, it would be great to have some action to figure out what is needed to support taking care of these products in a more responsible way. And I think that's a good conversation about what that would look like. I don't have a immediate answer for you on that. It's a really good question.
Fair enough. Fair enough. And just because so they're like there's a plastic piece, right? That could theoretically be recycled.
Yeah, there's a battery in the device, and you can charge it with your computer.
Battery.
Yeah. I mean, you're inhaling a heated element that then brings in whatever the flavored, whether it's flavored or cannabis or whatever you're smoking in there. You're inhaling that, so you're like sucking on a USB drive. Essentially, is what you're doing.
Yikes! Okay.
Is that what you were asking?
Yeah, just trying to think about. I mean, so there are the resources that could be going to lots of other things that are going into the production of these devices, and then they're just getting thrown out, right? So we know, for example, lithium is incredibly recyclable, but not if you just throw it on the ground and go about your day, right? All right, so lots of steps here, lots of problems to solve. Tell us again, and I know you've said this, but tell us again about this specific legislation. And does it have an LD number yet? And what's the best way to track it as it goes through?
Well, I'm really glad you asked me that. I don't remember the LD numbers. I'm going to see if I can find it. The bill sponsored by Senator Doosan from Portland. And it is an act to end the sale of flavored tobacco products. And it would end the sale and marketing of all flavored tobacco products in Maine. I will find the LD number and include that in the follow-up information, because I should definitely know that, but I don't. And if you want to get involved with the campaign, which we would love your help with, you can either go to flavorshitkidsmaine.org, or you can email me. I put my email in the chat. You can email Madeline Defose, who's our field director, and I believe her information will be sent in the follow-up materials. And then, like I said, if you own a business, we'd love to get you involved with Tobacco Free Maine Works. If you're connected to the campaign, once there are ways to get involved, either with visits to the State House, letters to the editor, other action steps like that, we can connect with you and help facilitate that process. We're always looking for people to contact their legislators about this, to let them know this is an issue that they care about. It's always helpful to show up and give testimony, but I know not everyone is comfortable with that. I think the biggest thing, depending on where folks are and in their comfort with engaging in the advocacy process, well, one is being here and learning about this issue. But two, I think just talking with others in your community, talking with kids in your community, and just having these conversations. We've been successful at passing municipal ordinances in Portland, Bangor, Brunswick, and most recently South Portland. And I mean, I've talked with retailers about it, and we don't have the same perspective on this issue, but it was good to have the conversation. And I think that that's important. Oftentimes, I feel like now things are really polarized, and you don't get to often have conversations with people that have a different perspective than you. And that's been happening. So that has been, I think, really important. Like I said, even though we have different perspectives, it's always good to have that conversation. So I will get the LD number for you to share with folks. But I think the biggest thing is, if you're interested in getting involved with this, either just emailing me or emailing Madeline.
Thank you. And all that contact info will be in the follow-up email later this afternoon. It's so great to hear about the towns in Maine that have already taken this action. And it makes me wonder as well that, we probably aren't the only state working on this, right? We probably aren't the only group of people who want to show kids that we care about them and that we're serious about protecting their health. Is there a similar campaign underway across, in other states? And is there an eye towards a federal ban? Is the FDA involved in this at all? Or where does it go from here?
It's a good question. So there are other states that have taken action. And in fact, the Supreme Court just upheld California's recent prohibition on the sale of flavored tobacco products. Massachusetts, our close neighbor, also ended the sale of flavored tobacco products. And then there are, I don't know the latest figure, but I know there's like more than 350. I don't know if it's closer to 400 now, but municipalities across the country that have ended flavored tobacco sales. And now we can add the Maine communities that I just mentioned to you, which is really exciting. So FDA action, it's so, on the one hand, yes, we need federal action. This should definitely be happening at the federal level. I think this problem is so significant and so serious that waiting for the FDA really is not a fair option to our kids. I think that it really is important that municipalities have passed it. I think it's important for the state to pass it. If we wait, the longer we wait for FDA action, the more kids are going to become addicted to these products. And that is just wrong from my perspective. But the FDA is taking action. It's going to take a long time for them to do it. The way that the tobacco industry works is they will do everything they can to delay action even longer. And the more that they do that, the more kids become addicted to these products. So my background before working at Maine Public Health Association was in food policy, and the example that I give in that field, which is different but still under the purview of the FDA, is that in 2010 the FDA directed Palm Wonderful, the pomegranate juice brand, to stop its cheat death advertising. I don't know if you've seen that before on their marketing, but the suggestion was that if you drank pomegranate juice, you could cheat death, which is obviously not true. But so it was an untruthful health claim on their product. Palm Wonderful, which is not as big as the tobacco industry, contested the marketing ban. And it wasn't until 3 years later that the FTC ruled against Palm Wonderful. And that was just one little example with a smaller industry, smaller product, not addictive, but just how long FDA action can take. And so when you think about relaying that to the tobacco industry and these products and what's at stake for the tobacco industry, but also what's at stake for our kids' health, to me, we really can't wait for FDA action. We need to take action sooner than that.
Here. And at the same time, it's good to know that's in the works, so we can talk about this issue as something where we are really linking arms with folks across the country to take action and live up to our Dear Ago motto. Becca, thank you so much. I have learned so much in this last hour, and I'm really grateful for you and for the work that you do at Maine Public Health Association, for the work of the Flavors Hook Kids campaign, and to all of you for being with us today and having such fabulous questions to help shape this truly fabulous conversation. You'll get that follow-up email later this afternoon, and I hope we will see all of you in this space again next week. Our topic for next week's Lunch and Learn is advocating for sustainability in Portland. Portland is Maine's largest city, and it's got a big role to play in how Maine rises to the challenge of climate change. So we will have City Councilor Andrew Zaro, who chairs the Sustainability and Transportation Committee, and Portland's Sustainability Coordinator Troy Moon with us next week. They're going to tell us what is going on and what we can look forward to in the days and months ahead. Thank you all. Have a terrific weekend, and we will see you again soon.